Welcome to episode 3 of Ready, Steady, Rehab on Wisp Sports Radio, where we believe that women in sport deserve equal coverage.
I was gonna give you advice, and if I knew you'd still be here today, I never would've rolled the dice.
Ready, Steady, Rehab is an all-new podcast about sports injuries, what can cause them, the symptoms to look out for, and the rehabilitation process.
Yeah, I dreamed about your sinister ways, try to block them out without a sound.
Welcome to the show. I'm Dr. Heather North, Doctor of Physical Therapy from Red Hammer Rehab. And on today's episode, I'll be talking about knee pain, basically lifting the veil of complexity for the average person. So, a lot of patients oftentimes get really, really nervous when they experience knee pain. They come into the office. A lot of times they're going to try to get an MRI first, or they're going to completely stop running, and they're worried that their exercise career is completely over because of the discomfort. So I really wanted to, first of all, just address some of the misconceptions of knee pain. The old wives' tale is basically that, the more active you are, the more sports you play, especially with running, that it increases your chance of arthritis. And that is completely bogus. So there's some really good recent research articles really debunking that fact. So they've looked at even large populations of active runners, and they've found the exact opposite. They've actually found that long-term running, even excessive running, will decrease your incidence of osteoarthritis and joint degeneration and everything like that, because actually stimulation to the joint itself helps to keep it really, really healthy. It helps to make the cartilage strong and all the connective tissue strong. So being active is not necessarily something that is going to cause arthritis or damage in the future. All right, so it's really important to understand that when you do have knee pain, there are two very different pieces of it. So one is internal joint discomfort and damage, and that is definitely something that we do want to worry about. But external knee pain is what is more commonly seen from patients. And external knee pain really refers to the muscles and the connective tissue on the outside of the joint. And this is not necessarily discomfort to be super concerned about. I mean, yes, you want to get it treated, see your massage therapist, see your doctor of physical therapy, and kind of get their advice on what to do to take care of those injuries. So most of the time, like I said, it is external or non-joint. If you have a lot of swelling, it can even be non-joint. So I'm going to go through different locations around the knee and kind of what might be going wrong and an explanation for that. So if you've got discomfort above your patella or your kneecap, so above it, and that's into that kind of quad attachment, those muscles on the front of your thigh that attach down by the kneecap, if that's where your discomfort is, most of the time that's from overutilizing the quad muscles, a lot of times not stretching enough. Again, this is an external joint issue. And then you can also have discomfort below the kneecap. You have your patellar tendon directly below. So that's that kneecap connective tissue that connects the bottom of your kneecap to your lower leg bone. And again, discomfort here can come from, again, not stretching your quads enough, doing a lot of sports that involve kicking or running. We see a lot of discomfort in this area in young athletes, especially at the lower leg bone attachment. So the solution for kind of both of these is actually to keep the quads nice and loose. And if the patient sits a lot during the day, make sure that you're keeping your legs straight, so you're not putting so much force along that kneecap during the day. You can have some internal or along the inside of the knee discomfort. There is an attachment of 3 tendons on the underside and inside below the kneecap called the pes anserin. And I don't know where they get all these names. These are Latin words. And pes anserin basically means duck foot in Latin. So if you can imagine what a duck foot looks like, there are those 3 tendons that attach on the below the kneecap to the inside of the leg there. And that can get irritated from too much internal rotation at the knee, meaning you don't have enough glute stability. We'll go through this kind of at the end, those exercises that can prevent knee discomfort. So you have one of those muscles is the quad muscle, one is an adductor muscle, and one is a hamstring muscle, and those all attach right on the inside. So that's just a basic tendonitis. And if we move up just a tiny bit from there, we can have a little bit of irritation, possibly to a bursa in that area. And bursa is just a fluid-filled sac that helps to decrease friction between tendons and the underlying bone. So pes anserin, or again, that 3 tendon attachment, can actually rub that and cause a little bit of bursitis or irritation. So again, nothing inside the knee joint. Your athletic career isn't over. Nothing's wrong with the actual functioning portion of the knee joint. So then if we go out to the outside or lateral aspect of the knee, IT band, iliotibial band discomfort is one of the most common ones that we see. Again, external knee joint issue. It can cause inflammation in the area. It can rub. It can be really uncomfortable. Ways to really help decrease the symptoms of this. You actually can't stretch your iliotibial band, which is everyone thinks that they can. You can't. So what you can do is you can change that relationship between the iliotibial band and your knee. So stabilizing the knee from the glutes, keeping it from preventing it from internally, as well as changing some of the ways that you run. If you land in front of your center of gravity or in front of your body, it puts a lot of force along that iliotibial band. We do have patients, though, go ahead and roll out that iliotibial band, though, because that can decrease adhesions between that outside quad muscle that sits right up underneath that iliotibial band. So breaks up those adhesions, kind of mashes that muscle a little bit, decreases any pressure that might be caused from that muscle. And then if we move just behind that IT band, you can have irritation from your outside hamstring muscle. And that's that tendon right behind the iliotibial band. It's a really common one. Things that can help this actually are stretching the quad muscles. Yes, I did say quad muscles. That's that muscle that can get a little bit too strong, and those poor hamstrings that help to control the quad muscle can get a little overwhelmed and get irritated. Again, changes in gait, rolling that hamstring muscle, working that tendon a little, that all can help. And again, remember, these are all external joint issues. So then if we go below the kneecap and kind of to the right underneath on the inside and the outside, to either side of the patellar tendon. This is tissue called retinaculum. Again, just crazy words. They need to just find better names for this stuff. But needless to say, it's called retinaculum. Just think of it as just a ran-wrappy material that basically helps to kind of tack your patella down, helps to give some stability to the area. And again, if you're overutilizing those quad muscles, not keeping them stretched enough, sitting all day, that tissue underneath can also get aggravated along with the patellar tendon or on its own. And this tissue discomfort can commonly be misdiagnosed as meniscus pain. So really important to make sure that you're not jumping to internal joint conclusions all the time. So when this tissue is irritated, stretching the quads, rolling the quads, and actually working that connective tissue can make a really, really big difference. All right, and then there is some discomfort that can happen underneath or below the kneecap, between the kneecap and the actual knee joint itself. And as we age, we all commonly get something called chondromalacia, which is an irritation and kind of roughening on the underside of the kneecap. If you're an active individual, most individuals do have this. So in order to keep that roughening from rubbing and becoming painful and swollen, again, stretching the quads and keeping that whole chain nice and loose, trying not to sit for prolonged periods of time, because that can also really press that kneecap into the underlying tissue. All right, and then we move behind the knee and the back of the knee. That can be from things like Baker's cysts. There's a muscle called the popliteus in the back of the knee. Again, both of these are external joint issues. A Baker's cyst is basically a large ganglion cyst. I know these are big words, but they're just irritation of a tendon, and that irritation then causes that tendon sheath to kind of pull up a little bit and fill with fluid. And that can go away on its own. Sometimes that does need to be drained, but usually it's not anything to be too worried about unless it's becoming really, really uncomfortable and decreasing your motion. The popliteus in the back of the knee is a muscle that actually helps to fully take your knee out of full extension and bend it. So instead of us thinking of the knee joint being a pure hinge joint, when it comes into full extension, it will actually lock down a little bit with what we call a screw home mechanism. So in order to undo that screwed position, that muscle contracts a little bit. So sometimes, again, sitting for prolonged periods of time, that muscle can get a little tight and a little irritated. So the best way to stretch that muscle is to take the knee into full extension, like you're going to kind of stretch your hamstring, and just put a little additional pressure above the kneecap and push back real gentle, and you'll feel slight pressure in the back of your knee that helps to stretch that muscle. So that's basically, in general, the majority of the knee issues that we see patients for when they come in. Again, above, below, side to side, behind, and diagonally below on the other side. So all those things not to worry about. I think you definitely saw some of the common themes here: quad stretching, foam rolling, trying not to sit for prolonged periods of time. So now I want to go into definitely what patients do worry about: internal knee pain. What happens if there is something that goes wrong in the knee joint itself? So there's several things that I definitely want to talk about, again, just to kind of let the common person know what these things are. It's not all that complex. So the first is meniscus damage, and those are kind of like, imagine two suction cups flipped on their back, and each suction cup sits on top of your lower leg bone, otherwise known as the tibia. And those suction cups interface with each side of your femur or your upper leg bone. And when you get an injury to that meniscus, it can cause a lot of swelling and discomfort. But again, really keep in mind that the research is not showing necessarily that every patient needs surgery, or even that surgery can be beneficial. So rehab, that knee, at least giving it 6 weeks of biking or non-weight bearing exercise, icing, heating, being good to your knee for a little bit to see if it can kind of heal up on its own. Most patients that I see with not super severe meniscus tears will do just fine without surgery. These injuries can occur from massive trauma. And so most of the time with knee pain that is internal, again, internal joint pain, it does happen with some type of trauma: a fall skiing, slipping on the ice, soccer accidents, things like that. So, and then we have collateral ligaments in the knee. So you have your ACL, PCL, anterior cruciate ligament, posterior cruciate ligament. So front and back cruciate basically means they just cross, and they cross in the knee joint. They help to prevent movement forward and backward of the tibia on the femur. And then you also have collateral ligaments on the outside of the knee joint and the inside of the knee joint. So lateral collateral ligament, LCL, MCL, medial collateral ligament. And those ligaments can be torn, again, from high velocity sports injuries, falls, things like that. Other things to think about are arthritis. So if you have, long-term swelling in your knee, which I would never recommend ignoring for a long period of time, that swelling or that fluid that sits in the knee will actually start to erode some of the cartilage or connective tissue in the joint. And that's what causes arthritis. That actually is arthritis. Arthritis isn't a disease, it's a condition where you're actually getting degrading of the cartilage tissue in a joint, and it starts to basically break into the bone. So it begins to be bone on bone, so you don't have that nice flexible meniscus interfacing with that nice slick cartilage covering of the femur. You can also have bony contusions in the knee joint from too much pounding, too much pressure. We'll see that a lot with, ski racers, ultra runners, things like that, where there's a lot of pounding, basketball players, and those contusions can actually be really, really painful. You treat that just like a bone bruise, so it just takes some time to heal. So any of those injuries, collateral ligament tears definitely will require some surgery. Meniscus injuries sometimes will require surgery. Arthritis sometimes can be staved off a little bit utilizing kind of like a viscous fluid injection. They last for about 6 months. And so if you're a younger patient and you're thinking that you need a knee replacement, try those injections first. So again, the arthritis doesn't always need surgery, especially if it's non-painful. But you do want to be seeking surgery if you're not able to enjoy the things that you really like to do. So, all right, so enough of that morbid and sad stuff. Again, most patients really aren't going to deal with internal knee issues when they come in to see us, but it does happen, especially in all of those high-level athletes. But again, don't be scared. Again, just thinking about those really simple structures in the knee joint that can be damaged: meniscus, collateral ligaments, cartilage covering of the femur, those things. Again, it's not all that complex. All right, so let's go ahead and talk about just a few exercises that you can do at home to keep your knees healthy. So it used to be thought that we could strengthen our VMO or our medial quad muscle, and that was going to definitely keep our knees tracking straight. Absolutely incorrect. So research-based is really showing that strengthening our gluteus maximus and gluteus medius muscles will help keep our knees strong in a three-dimensional plane. So it prevents internal rotation at the knee during the stance phase of walking or running. And you can do those exercises, really simple donkey kicks. So going on to hands and knees, lifting that leg directly behind you. That targets the gluteus maximus muscle, that driver muscle. And then if you want to target the gluteus medius muscle, that muscle that really prevents that internal rotation of the knee, you just walk that leg behind you out about 45 degrees and you can lift that leg in that plane. All right, so keeping that butt nice and strong. And then I really like patients to stretch their quads, especially if you're doing a sport like horseback riding, biking, running, even skiing. You want strong quads, but you don't want to overdo it. So you can do things like leg press and lunges and squats, but don't overdo it. Remember, your sport is going to keep those quads pretty strong already. So you want to reinforce that strength with also doing some stretching and rolling. So even taking a basic kitchen rolling pin on the front of your quad can make a big difference. And just that basic standing quad stretch. So spend that time when you're done exercising. And the last exercise is to do a little bit of hamstring strengthening. Again, that muscle that counteracts that quad. Basic hamstring curls. You can lay on your stomach with a weight wrapped around your ankle. Nice and slow, 3 sets of 15 every other day. All right, so hopefully that cleared up a lot of the misconceptions about knee pain and simplified it all a little bit for you guys. So I hope you found this helpful. And if you would like more information, please visit my website at redhammerrehab.com. It's provided in the show notes. And you can also email info@wispsports.com with any questions that you might have about sports injuries. On the next episode, I will be addressing a popular topic that I find a lot of athletes want to know about. So it's the top 6 exercises for athletes to stay healthy. There will also be links in the show notes accompanying this episode at wispsports.com. Just go to listen and click on Ready, Steady, Rehab. For more conversations from the world of women's sport, visit wispsports.com and subscribe to Wisp Sports Radio on your podcast player. You can also post your comments and share on social media. Just look for @RedHammerRehab and @WispSports. Thanks again for listening and supporting women in sport.